My name is Martha. In the last year, I've noticed a significant change in my vision. It feels like a shadow. It's blurry, it's foggy, and at the end of the day, it just starts to come in like this, like a tunnel vision. Whether it was reading a magazine, looking at an iPhone, walking up and down the stairs, driving, it's become a potential hazard, a health risk. Last month, I started taking packing tape and I taped up my eyelids. After seeing my optometrist, I was referred to Dr. Zumalik.
Martha suffers from droopy upper eyelids, which we call eyelid ptosis. What she has is extra skin that's draped over her upper lids, and it's causing her to have decreased visual function. She's having an inability to see well in her peripheral visual fields. The goal is to not only for her to see better, but also to look natural, look more rested, and less tired. So we're going to start by performing an incision along the right upper eyelid, and then we'll remove the skin while sparing the underlying muscle. Now we're just cauterizing some of the little bleeders. And so we can see here is a healthy bed of orbicularis layer muscle. That's the muscle that we see underneath. So this is essentially what functions to allow for our eyelid to close during our day-to-day activities and also shut our eyes when we're sleeping. Once we've decided that there's adequate control of bleeding, we'll go ahead and close up with some sutures. So now we'll start with the other side. And I tailor that laterally to hide her incision and her natural wrinkles. I removed a little bit more skin on the right side. That's the one that had more hooding. And cut. And we are done.
Dr. Zumalik and Martha join us here just 3 days after that surgery was performed, and the proof is in the pudding.
Thank you. The sutures, I'm looking at her sutures. I don't know if you can see it, so I assume they're going to be coming out pretty soon.
Correct. They'll be coming out on post-op day 6, which will be Monday.
This is a procedure that is performed for someone who has this chronic problem, right? This isn't...
Absolutely. Absolutely. This is an age-acquired issue that we see in our practice. It's commonly seen with excess skin that's draped over the lids and the lashes, and that causes an obstruction in the visual fields. The peripheral vision can be affected. People have difficulty seeing and driving well. And it's not an acute, it's a chronic process.
Yeah, this case is really more just excess skin of the upper eyelid. True ptosis is where you have those so-called bedroom eyes, sleepy eyes that fall lower on the eyelids, and that's a different procedure.
Correct. We evaluate for that as well, too. That can be addressed at the same time, and you can tighten that muscle to lift the eyelid up. In her particular case, her eyelid position is perfect. Just the extra skin was causing a problem.
Let's show everybody what you did there, doctor.
You can kind of take a look at what we see here. Is the left eyelid looks nice contour, nice height. There's not a lot of extra skin there, whereas the right side, we can see what, similar to Martha had, was extra skin that was blocking her peripheral vision. And so we've already made a marking of what we're going to remove, and that's the skin that's draped over her eyelids that we're going to remove. And we're going to go ahead and use our blade to carefully cut while preserving underlying muscle, so we're only removing skin itself.
And those markings are so important because it allows us, if there's a difference between the two sides,
absolutely,
you can compensate for that at the same time.
Absolutely, and no eyelid is the same, so you have to be careful of how much you remove on one side and try to match it to the other as best as you can. And so we remove the skin and spare the underlying muscle, which we're doing here, and that's certainly usually comes out in one piece.
You pull that out, it's going to look great.
And then we use our magical sutures to kind of bring that together, and you can see that the contour now is visible, and you have an improvement in the peripheral vision once you remove that excess skin.